Hey everybody. Oh my gosh, I just came on here and see everybody first, second. Hello, hello. This is awesome that you guys are here. Um if for some reason you can't hear me because I have nobody to let me know that, please let me know. If you can hear me, that'd be great. Um yeah, Adrienne or Sonia or Dizzy, if you could let me know just to sound check myself. Let's see. Um, so we are going to be talking today about Carly Gregg. Okay, perfect. You can hear me. Awesome. Thank you. Just wanted to make sure before I got too far into it. I am Dr. Rachel, for those of you who don't know. I am a clinical and forensic psychologist, and I do primarily civil work. So I work primarily in family court matters, but I do some criminal forensics as well. And this case piqued my interest in particular because number one, any insanity case I'm going to be just largely invested in. I'm very interested. I love watching other experts testify. I learned so much from watching people. It's really cool. And I love being able to help educate other people about it too, because I think there's just so many things, so many differences between like what clinical therapists and psychologists do versus forensic. I was particularly interested in this one because she's an adolescent claiming insanity and just some of the foundational things. And so I kind of want to start with that. But for anyone who's here who doesn't know, Carly Gregg was 14 at the time of the crime, which was March 19th this year, not that long ago, 2024, pleading insanity for the murder of her mother and attempted murder of her stepfather. This is in the state of Mississippi, which I'm not totally familiar with all of their laws, and I know some of that comes into play here. And I'm not an attorney, so I can't answer all of those questions. But she was tried as an adult, and she's been held in an adult jail in solitary pending her trial. So I want to kind of talk. I got so many good questions from you guys too. And I'm sorry if I don't, if you have other questions, I will go back sort of and scroll through. But I have so much to cover from what you guys gave me, which was awesome. So thank you. Um, so I want to talk in general first, my overall thoughts about the way this was set up. So Carly being tried as an adult at 14, I know that this is guided by different states' laws, and they have different parameters for this. Um, it's my belief, in particular, if there's a mental health issue involved, that trying a juvenile as an adult, especially at age 14, 13, is not appropriate. And I may get backlash from that. I know some people say, you do adult crimes, you get tried as an adult. But there's so many things that go along with that that don't necessarily promote the possibility of rehabilitation, and that becomes a problem. So she's been held in this adult prison, which for her own safety, quite honestly, she needs to be in solitary confinement. And I don't know how many of you guys have ever been inside of a jail. I did work in the prison system for several years. Supermax prisons, males, females, they are not pleasant places, obviously, for obvious reasons. Even people who do not have mental illness can really struggle with isolation. For her, what this means is 23 hours a day in cell on lockdown and 1 hour out where she could shower. Sometimes they have like rec areas that indoors or out, but it's all caged in. You can basically walk in a circle, do some push ups, that kind of thing. And it is, you're eating in your cell, you're not able to communicate with other people, especially for her, not able to communicate with any of her peers. And so that to me is very problematic, in particular because she was someone presumed to have a mental illness. Um, I cannot even imagine being 14, 15 years old in solitary confinement. If I don't know what her institutional record looks like, meaning what has her behavior been like in prison. I suppose, there can be a review, some classification that's done within the prison system where they decide what the most appropriate housing is for you. I just think that's been when somebody is psychotic, meaning, and let's just presume for a moment that she has a psychotic disorder. which we'll talk about that a little bit later, but let's just assume they do. Isolation is a terrible thing for people who have psychotic disorders. It's part of why we have programming in the community, case management programming, day programs for people who are severely mentally ill, because when you do not have a good grasp on reality, it's helpful to have a broader picture to bounce things off of, right? And so, is this real? Is this not? It can help distract you from auditory hallucinations. If you have a thought disorder where your thoughts are kind of jumbled, disorganized at times, having other people around to keep you focused, to help you, say this is not reality or this is that kind of thing. It's very helpful. And also, we should all know that our social network is a huge protective factor when it comes to mental health. So if you feel all alone with no support, how's your mental health going to suffer? Everyone's is going to, right? Even people who are introverted. So she's very isolated. She's only talking to prison guards and I suppose on the phone when she can, and none of her peers, nobody that's her peer. I have a huge problem with that. In addition, the psychiatric treatment in prison, let's just break that down a little bit. So, for severely mentally ill people, sometimes once sentenced, it's typically not in pretrial. They do have special needs units. These are still not intensive programs, right? They see the psychiatrist more often. They do probably have access to more group therapy and things like that. Carly, in being in isolation, she's not in a mental health program right now. She is seeing a psychiatrist, which is probably cell side, with very little confidentiality, and she can get medications, but they prescribe typically the cheapest medications because in prison they have these formularies where of what the state's willing to pay for. So their options for medications are not as broad as they would be in the community. Mental health, she is absolutely not getting therapy. I don't care what anybody says, even if you work in a prison and say you do therapy. It's not the type of therapy someone needs who is going through what she's going through, and who is in isolation in a prison with severe mental illness. She will get daily cell checks. So when I worked in the prison, we would go around, hey, doing okay? You need mental health? Nope. Okay. Hey, doing okay? Need mental health? Nope. Let me tell you the stuff that you see and the way people respond at times, but I digress. So, you know, half the time people are half asleep, no, whatever. Okay, good to see you're alive. It's basically, are you alive? Check. And if and she's certainly not going to be getting therapy. So, working in a prison is a lot of crisis management. The people who are acting up, who have behavioral issues, who are actively suicidal, those are the ones that are taking up all of your day. And the people who really just like need to talk and need to have symptoms monitored and things like that, they aren't getting hardly anything. I think probably because she's high profile, she might be getting like a weekly session with somebody, but she's not dealing with issues. I mean, they're talking about, are you suicidal? Are you homicidal? Are you eating? There's no like actual work going on, especially in pretrial. So I have a really hard time with this situation for her where she was when this started off. The other general thing I want to talk about is how her evaluations came to be. So, as a forensic psychologist, I will get referrals typically when there's an indication that mental illness is involved, and especially if they think it's going to potentially have a not guilty by reason of insanity plea. The defense wants me to see them as close to the crime as possible so that I can get a mental status on them. Like, if this crime happened yesterday, they want they want me there today, or they want me there within the week to capture what is that person doing, thinking, feeling right then, right? That makes sense because the closer to the crime you can capture that, the more accurate your evaluation of insanity is going to be. Because as time goes on, if somebody is psychotic in whether they're insane or not, when someone's psychotic in a situation, it will make it much more difficult for them to describe what was going on at that time the longer you wait, because oftentimes they don't really remember a whole lot, or it's jumbled and it's just kind of hard to know. So, why didn't that happen here? Well, we don't know if it did, right? I was having this discussion with somebody not too long ago, and I was saying, you know, why in the world did they wait until the end of August to have this child evaluated? A couple things. Either one, they didn't, and that's bad, or they might have had her evaluated early on. For all we know, she was evaluated several times. But if the defense could not get somebody to say, yes, she was insane at the time of the crime, they may have decided not to use them. And it could have taken a while for them to find somebody who would opine that she was insane. And I did kind of wonder why they chose this person out of Massachusetts who had never been in Mississippi before. Um, so my suspicion is that he was the one they could find with the right credentials to opine that she was insane at the time of the crime. Um, it poses some issues, which it did for his report because he did not apparently address properly what the Mississippi law states as far as qualifying for insanity. Um, so that's absolutely a problem. Um, and some of you guys were asking me about her records from before, and so I want to talk a little bit about that. So someone had asked me, number one, about issues related to confidentiality when you're a treatment provider who has to testify. Something that I've talked to a couple people about also is this idea that in her documentation prior to the crime, she didn't tell treatment providers she was hearing voices. She didn't tell people that she was having these, or she didn't tell her treatment provider she was having these dissociative episodes. And so that wasn't helpful, right? Um, so let me address the confidentiality thing first. When you are not a forensic psychologist, if a patient just comes to you and says, I want treatment, right? And then at some point something happens and they're involved in a court matter and you get subpoenaed. As therapists, as treatment providers, we hate that. In fact, there are some clinics here where I live where they won't take people if they're involved due to court related issues because of the confidentiality issue. So if you when you go to therapy, you sign confidentiality forms, so you know that your information can't go anywhere without your consent, um, unless, they aren't gonna be disclosing things that happen in therapy unless you tell them you're gonna hurt someone else, right? So when you go into a courtroom and you have to testify, you have to assume the right thing has been done. So, I always tell people as therapists, if you get a subpoena, you have to respond to it, but you do not necessarily have to testify. And that is because there are steps. If you believe that what is in the record may be harmful to your client, then there are a lot of steps that you have to take. Um, Number one, if I got a subpoena in this situation, I would first reach out and try to contact Carly and ask her if it's okay to release the records, right? So, Adrian, I'm going to actually get back to that because in some ways you can, but and I would try to get Carly to sign a release of information. And I would explain to her, if I release these records, this is what they're going to see. This is what I said in my records. This could potentially, I go over with them any potential harm that it could do to them so they can make that informed decision. If they sign, then okay, you've gone through it, you've explained everything. Um, if your client you feel like can't properly give that consent, that they're like if too young or they're mentally ill and you don't feel like their judgment is very good, what you can do is you respond to the subpoena. You can speak with the attorney who sent it to you because a subpoena is not a court order. A subpoena is something that the attorney asks for you to respond to. So you can call that attorney and say, hey, I have these concerns. Can we talk about how to do this instead? In a way that, can I write you a treatment summary instead of giving over all of my records? And that way I can kind of control the details and give, diagnosis, treatment plan, ultimately what happened with the case and not have the details of like what the person said in each session and those kinds of things. Um, If they say, no, we want your record, we want your record." So what I would do is I would one of 2 things. I would show up for the testimony, and I would say on the stand when they ask me questions, "I do not feel comfortable providing this information, Your Honor. I feel that it will be harmful to my client, and I have an ethical responsibility to protect my client." And the judge can say a lot of things. The judge can say, "Well, too bad. You need to provide this information and you need to answer that question, in which case that's considered a court order and I have to do it. But at least I did everything, right?" Or the judge can say, "Okay, well, I understand there are legitimate concerns here. I'll look at the record and decide if this is okay to release to the attorneys or not." Um, or they may say, "I've heard you. I understand these concerns. I think they're legit. You may issue a treatment summary instead." So you still have to respond to it, but you have to do everything you can if you feel like something's going to harm your client. And you, at the very least, need to have consent from your client to do that. So just because you get a subpoena doesn't mean, oh, great, well, I have to give up everything. So I imagine that this therapist got consent from Carly, that she discussed with the attorneys, the subpoena. Um, and I think that she understood that Carly was a child who did not always trust the people she was talking to, and that she had very good rapport with her. And so she didn't want to be up there telling all of the details. And I think that was really hard. Right. And if you're 14, technically, it depends on the state. Some states allow them to consent at that age. If you, as a therapist, feel like, no, there are cognitive limitations, there are issues, so there's that piece of it. Then that's when you kind of still have to advocate for your client. And also, treatment summary is typically like they they started therapy on this date, they came to sessions on these dates. These were the general treatment recommendations. This is the type of therapy we did. This was the last date of treatment. Here was her diagnosis. The end, right? So it's not those like, um, in this session she said this, and you aren't turning over all of the observations you make about their mood each time and that kind of thing. So yes, it's pretty basic. But that's the point, right? And I always try to offer those first. Like if you just need to know that she attended therapy, then I can give you the dates of that. That's fine. But if you don't, if you're looking for my entire record to pick apart, then that's going to be a different issue. And here's part of why the record being picked apart is an issue. So you would notice when talking to the treatment providers, they would say, "Okay, and so you checked off that affect was normal. What does that mean? Okay, and you also checked off that thoughts were logical and organized. What does that mean?" So for every note, you're going to go through this mental status exam, and let me tell you how fast those things are checked off. This is not an evaluation at each session. Like this is not a full evaluation. If somebody comes in to me and they're talking and they're coherent and blah 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 blah, that like everything just seems normal. We had a session, we talked about their treatment, they left, nothing wildly, whatever. Everything's going to be marked normal. Even if I'm not going to go through and say, "Are you hearing voices today? What is your mood today? Like how many times did you shower this week?" I'm doing it based on just the interaction, right? And so it's not this evaluative thing that in court they often make it seem to be, right? So there's not like a ton of digging in that situation. You're just like, yeah, they seemed fine. It's not that meaningful. Okay. Um, the experts overall, um, and I hope that answered the confidentiality situations. Therapists hate to testify. They're not trained in how to do it, and they don't want to break confidentiality. And it's very nerve-wracking to be on the stand, whether you're a forensic psychologist or you're a clinical psychologist. Nobody likes to testify. Well, I like to testify, but it still can be really nerve-wracking. So yeah, so I always feel bad for therapists when they get up there because they don't want to hurt their client no matter what, and it's tough. And I see what you guys are all talking about in the chat, and I am going to get there, I promise. So the overall I got asked the question of what I thought about each of the experts, who I most aligned with, in terms of their opinion. So I'm just gonna give an overall my overall opinion of Carly in general, and I'm not gonna try to sit here and diagnose her. I don't think anybody truly properly diagnosed her. That's besides the point. I think that Carly is severely mentally ill. I think her cluster of symptoms that she reported makes sense to me that she's very disturbed in terms of being psychologically disordered. I do not think that she was insane at the time of the crime, but I do think that her mental illness heavily influenced the crime that was committed. And if you guys have further questions about that, what I mean by that, so I don't think that she was insane. However, some states have a statute for guilty but mentally ill, and that is pretty much what I'm referring to. In which case, when those people become um, significantly symptomatic, they have the ability to take transfer them to the state hospital for treatment until they stabilize and can function normally in general population. So they also get classified differently in prisons. So they have greater access to the special needs units and mental health treatment that is a little bit more substantial in the prison. And so that is where I kind of stand on that. I think that it is entirely possible that she suffered from dissociative experiences, and that's what she was describing, where she feels kind of out of body, that she's watching herself, that she feels like things aren't real. Um, and I want to say something about that. So there's a spectrum of dissociation. We all do it from time to time, and it's not always in response to something super stressful. So the best example I can give of a normal dissociation is when you're driving and all of a sudden you're like, "Oh my gosh, my exit was like 2 miles back. What the heck? I don't even remember getting there." And yet you've been driving and paying attention and shifting lanes and you kind of think, "Oh, that's kind of weird. That's scary." You can do organized intentional things when you dissociate. And so I definitely disagreed with Dr. Pickett when he talked about dissociation. He was focused only on the most severe kind because of what she described. But I don't, but you can have dissociative experiences on a spectrum, and especially when a mental illness is developing, those experiences of dissociation and experiences of psychosis can look a little bit different and they're not as cut and dry. And I felt like Dr. Pickett really focused his evaluation seemed as if he was evaluating an adult. So I felt that he approached her diagnosis as someone who had a very well developed mental illness and that wasn't as severe because he didn't believe a lot of her symptoms. Um, so I didn't really agree with that. I thought he left out a lot of the developmental stuff. Oh my gosh, I'll tell you guys, not too long ago, this is after I had kids, I was, like, looking through some old memorabilia and stuff, and I had saved every journal I wrote as an adolescent. Do you wanna know what I did with those? I got rid of them. I threw them I shredded them and threw them away because God forbid my kids if something happened to me, my kids ever go through those and read that, or anyone for that matter. Adolescent journals can be I thought it was great that the defense pointed out how she was referencing a video game and a couple movies and things like that, and I don't discount how serious some of the things were that she was writing, but I do think some of the things she was writing were sort of like attention seeking, video game kind of stuff, sort of a fantasy world, and for her, it's significant because of ultimately what she did. But for any other teenager, I think parents might be like, "Okay, we're gonna limit your access to video games and that kind of stuff," but I don't think that it would have been blown out of proportion like he did, in terms of, like, I don't know how much that actually connected to her mental health except okay, wait, dissociation. Oh, Adrian's dissociating when we talk about that. Yeah, so Dr. Pickett, I feel like he was very qualified and had good experience, but there was something about him where I just I felt that he okay, well, let's talk about this. Let's talk about trauma because, I don't think either one of the experts focused on how trauma in her early life could have been affecting her. I thought it very strange that the so she had an 18-month-old sister that passed away from genetic complications when she was 4, and that is very significant to me, especially when considering some of the things she was talking to her therapist about, like, what's the meaning of life? Is there even a God? When we die, it's over. It doesn't even matter. Life is meaningless because if we just die and we're gone, then oh well. And you know, this centering around death, I feel like that's such a significant when you my daughter was 3 when my son was born, and her attachment to him was real, and had something happened to him after almost 2 years, that would be extremely traumatic. And the aftermath of that as well, I can't even we don't know how her mom reacted to that. If this child had a genetic disorder for those 18 months, I'm sure they were in the hospital and at doctors a lot. I'm sure that her mother was doing, that was very stressful and traumatic time for her. And having a 4-year-old who needs a lot of attention, there can often be neglect, emotional neglect of the child that's living. We don't know if her mom was depressed for 3 years and the next 3 years in bed with her, and that's why she had to go to dad's, but also her parents divorced when she was 4. So these 2 things happened at 4 years old, and I just thought they were so discounted. Um, I really did, and I think the dissociation that she experienced could have resulted from that, but if Carly is telling the truth, that she doesn't remember that entire lapse of time, if she's telling the truth that there have been other times where she has lost time, as traumatic as those events are, she has if it's true, there is more trauma we don't know about because that type of dissociation is on the very severe end of the spectrum, and we're talking about severe abuse in early childhood, severe abuse potentially ongoing. And so I don't want to speculate because we don't have those as facts, but I know that there were a lot of people that had their spidey senses up about her stepfather. And quite honestly, her biological dad was a hot mess too. We don't know, and if Carly is dissociative to the point where these things can happen and she can do these organized things without knowing, we're looking at a dissociative identity disorder, which no one picked up on, and I think for the most part, um, providers shy away from that. It's a very, very rare diagnosis, and they wouldn't have been able to make that diagnosis if they didn't have information about severe early trauma. They can't because that would not be a reaction to the trauma that she experienced. It would be more than that. I feel like there are just still so many unanswered questions about her actual diagnosis. The thing that makes this so hard too is that Carly's not an adult and she's not a sophisticated in this way that she can describe her symptoms. If she is dissociative to that degree, she wouldn't be aware of that really. She would know she missed time, but um she wouldn't be able to describe her symptoms would be so spotty. Um it would be hard for her to describe them, especially as a teenager. I mean, it's only 14 years of life and really what 3, 4 years old, more like 5 when you have your first memories and so we're talking only like 9 years of memories. Um so yeah, and people have been pretty vile online about it, and so, I know it's been really awful. So, yeah, I don't think the full developmental I don't feel like that was focused on very much. Heath and Carly's relationship, we don't know, okay? Let's just put it that way. I'm just gonna go based on what I have seen and what we do know. We do know that, Heath was in her life since 2019, got married to her mom in 2020. And by all accounts, great relationship, that it was fine, and, that's really all we know. We also know that we saw some really strange behavior. I've thought a lot about this. It was strange. It's very strange, especially because he's a victim. I do think that she wanted to kill him that day. I think what Dr. Pickett described was important. I think that when she was in her mom's room, she heard a noise. It was the dogs, right? And she screamed, "Heath, Heath, Heath," which she said his name 3 times, so we're gonna get to that in a second because that's gonna sound a little conspiracy, but, anyways. So called Heath, didn't hear anything, so went in, realized it was the dogs, said, "Oh my god," like, took the made the dogs go back out. I think it was at that point that she saw the camera and took it down. I don't know that for sure, but I do, and I think when she was hiding the camera, Heath came in, and it shocked her because what she was trying to do was lure him back to the bedroom to shoot him, and the timing of it, she went to go let the dogs out, she hid the camera, he showed up, and I think she was shocked. I think she turned around and was scared because she hadn't planned it that way, and that's why her shot was off, and that's why she screamed and then freaked and ran. So, yes. So, I think that's why he only got grazed and then she ran because that wasn't how it was supposed to go. Now, when Carly was in her interviews with these psychiatrists and she told them, "I don't remember the crime," I would have tested that. I think I would have gone back and said something like, "Before you did this, what did you expect was gonna happen? Like, if you killed your mom and you killed Heath, what did you think would happen after that?" And see if she would answer. If she would answer, then we know, like, she did recall doing it and planning it, right? I think those are the kind of questions that when you're 14, you slip up on and say, "Well, I don't know. I didn't really think about it," or "I thought I would just run away and never be found and I'd be fine," or whatever the case may be. I think one of the questions I got is, "What would you have asked her? What would you want to know more about?" And I would have wanted to know way more about her relationship with her stepdad. I would have pried more about her relationship with her mom, and maybe they did, but they just didn't really talk about those details. Dr. Pickett, okay, I'm that man is a robot. He has to be because I don't know how he wrote an 85-page report in 3 weeks and did all of this. But anyway, so they both spent 4 hours with her. That's fine. They didn't talk about any of the testing that they did. That was weird. And I think when I evaluate people, especially when it's like this complicated of a case, as I'm writing, I'm thinking of more questions that I want to ask them. And so I want another chance to talk with them. And, it could have been they ran out of money or time or whatever, and they didn't. But I thought that was a little weird. They didn't follow up. So I would have asked more follow up questions about that. Um, Dr. Clark said that it was like pulling teeth to get responses out of her. So that could have been an issue too if she just wouldn't talk about it. So back to Heath, we saw bizarre behavior in court. We saw him mouthing "I love you" to her, smiling, and her response. It was giddy. It was really strange. Heath to me is introverted. I think he was really uncomfortable in the stand. I think he's really depressed. Um, he was absolutely trying to protect Carly on the stand. He's trying to be really careful about anything that would make her look bad. I I don't know if he and his it's only been 6 months. I don't know if he feels like a rejection of Carly's a rejection of his wife. Um, I don't know if he is just feeling empathetic toward I'm sorry, my dog is squeaking a toy. I don't know if he is feeling empathetic toward Carly having to be in solitary and he wants her like, he's trying to just in this horrifying situation be something positive toward her to help her emotionally, like, "We also love you, like, it's gonna be okay," like, it was very odd when, um, the attorney had him point Carly out and said, "Is that the person that shot you?" And he kinda went, "Yes." He, like, smiled, but I feel like it was just awkward. Like, it was an awkward thing to have to admit with her sitting right there. I really don't even know. I don't know. I don't think Heath had anything to do with what happened, with the shooting. I don't think it was, like, all pinned on her. And here's the other thing, he said he's been talking to her almost every day. I promise you the prosecution has been reading and listening to all of that. And I think if there was anything nefarious going on, that they would have pounced on it, because they wouldn't want that guy walking the street either. It's all very odd. And her family in the one hearing said they would be fine with her out on bond. Like, everyone raised their hand. It was very clear her grandparents, which, by the way, those two people I believe were Ashley's parents who kept talking to her. Um, so the with them all supporting Carly, I think everyone is just so shocked this happened, and there's no other explanation to them but mental illness. And if I put myself in Ashley's shoes, let's just say, so if I could see into the future and would know that that was going to happen to me, I have a 14-year-old daughter. Um, would I want my daughter to be in solitary confinement for the rest of her life or in jail for the rest of her life with no parole because of that? I wouldn't. I wouldn't. Um, I would want her to get the help that she needed and have a chance at rehabilitation. And so part of me wondered, is that how her family's viewing this? Is like Ashley would not want this for her regardless. Um, so it's very odd. And so Heath not talking to the psychologist. So he did talk to the defense psychologist, and then according to the state psychiatrist, he tried to call Heath. Heath didn't return his call, and then there was like no follow-up. And that could have been a time restriction thing, but that is I feel like that would have been a really essential thing before issuing a report. I mean, you would have to talk to the stepdad, and as an evaluator, I would probably go to the state and say, "He won't talk to me," and then I would have the state attempt to have him court ordered to participate. So that was really strange. I don't know, but then Heath also alluded in his testimony to saying that the state told him he wasn't allowed to talk to anybody anymore, and he, I think, was just, like, over the state at that point. So he may have been like, "Forget it." Because Heath talking to the state psychiatrist probably would have been helpful to Carly. I truly don't think either one of those evaluators, helped Carly whatsoever. But, so let's see here, what else do I have? So will Carly get enough help? Um, as is now, no, she's not going to. She won't. She's gonna get very minimal, mental health, um intervention at this point. I'm sure they're appealing. I wanna say something about this. I don't know if you guys saw the, defense attorneys speak on the, to the news. They talked about how they told Carly, like, "This isn't the end of the road, this isn't over, they're going to be, um, they're gonna be appealing, this isn't the end of the road." Okay, so you saw Carly break down when they handed down the handed down the, verdict. At first, she was like, I mean, come on, how could she possibly react? She is also on a really high dose of antipsychotic medication, which makes it difficult to express your feelings, but, then she kinda broke down, right, at the table, and then she left, and when she came back for sentencing, "I want you guys to go back, and I want you to watch when she's at the podium." Now, if I didn't believe that she dissociated in her lifetime, I believe it now, because I believe that she was absolutely 100% dissociative at that podium. I would just want you to watch her. I want you to watch her face. I want you to watch where she looks and what she's doing. She was not present for that sentencing. She totally wasn't. Um, so yeah, she has been in solitary for 186. So I think she broke down when the reality set in while she was out of the courtroom. I think she left. I think she left herself psychologically, and that's what got her through the sentencing. I was shocked that they didn't give her parole, an option for parole. Someone said that in Mississippi, after 20 years, if you're a juvenile, when you were convicted, that you automatically get up for a chance at parole. But I think, yeah, Diamond Dave J. Yeah, I think, yeah, I wondered at times during the trial too when they showed her when she sort of just looked like real blinky and out of it. So yeah, I think I mean, dissociating is a protective mechanism that your brain does when you're triggered. You can dissociate. I mean, if something like that ever, if I were ever wrongfully convicted of something, I'd probably dissociate. But yeah, she's very seriously medicated too. Um, so let's talk about this. This is going to sound conspiracy-ish. One of the things that when somebody has intrusive thoughts that they can't stop thinking about, so for example, thoughts of death, thoughts of killing, thoughts of, that pop in, they can't control them. They're very dark. They're very hard to control. Sometimes I would always be asking in an interview about obsessive thoughts and compulsive behaviors. So people with OCD, right? They have certain ways they have to do things because if they don't, it creates a lot of anxiety for them. And it's based on obsessive thoughts. So these thoughts about like, I have to do this, I have to do this. And if I don't, what happens? So a more like one like hand washing is one you guys probably heard of. People who feel like I have to wash my hands. Okay, they're not clean enough. I have to wash them again. Oh my gosh, they're not clean. Like germs, obsessions about germs and feeling like, oh my gosh, if I don't wash my hands 14 times a day, then I'm going to die, that kind of thing. So it made me wonder finding out that this particular gun she had fired before and it has 7 bullets in it, but she fired 3 at her mom, and it seemed like there was so much time in between the 3, and I was like, "Did it have to be 3?" And then she told her friend, "I have 3 more for stepdad." And I was like, "Why is she doing 3 and 3 when there's 7 in there, and why does it have to be 3? Like, does it have to be does she have to fire 3?" And she did. She fired 3 at mom, she fired 3 at Ed. So I kind of wondered if that was related to some kind of, fixation on 3, like she had to do things in threes. Um, and then she even called out Heath's name 3 times. But nobody said anything about that, and that could just be me, like, overly picking up on things. Someone said that had told me on Twitter that the gun that she fired would have been, like, hard to squeeze, and so that could be the delay, but also mom, after the first shot, made a sound, and then she did miss once, and then apparently wanted to, make sure, that she had passed away. But the 3 for him, it was like, "Okay, what, you have 3 left in case you miss kinda thing, or you have to fire 3?" I just thought that was interesting. Yeah, Pokemon, yeah, raising teens made me wanna dissociate. Yeah, they flew the nest and said, "Oh my gosh, it's in 20 years already?" Like, I know, right? I think that already, and my kids aren't even gone yet. It's like, "Gosh, did I actually live those years?" It's so crazy. Um One of the questions that I got was about the prosecution saying the why of this crime doesn't matter. I totally disagree about that. In an insanity case, the why absolutely matters. And I didn't get a sense that that was explored much with Carly. And I think it's because she told the evaluators, I don't remember. And so, how could she talk about why if she didn't remember? But I feel like they could have talked to her more about what was happening just before. Yes, your mom, what did you think about the fact that your mom had um, have found out you were using drugs? What did you think about how are you feeling about that? Like, there just wasn't a lot about that. Was she thinking and feeling that she does remember that would have caused her maybe to dissociate? There wasn't a lot about it's just that was just kind of strange to me, and maybe it's in their report, but they didn't articulate it. But I feel like that's a very important part of it. Like, what triggered this dissociative state? Were you hyperventilating and then all of a sudden you don't remember anything? Were you thinking, "Oh my gosh, I don't know what's gonna happen because they just found this out," or were you just thinking, "Oh, I gotta get the dogs to pee." Like, I don't they just didn't, um yeah, they didn't there was nothing. Oh, she walked back 3 times too. Oh gosh, checking 3 times. Um, yeah, so, like, her mom told her no about something, and maybe it pissed her but, like, I just don't but that's not that's the thing, though. she doesn't have, so if that's the case, if this was just about her being mad that her mom found this stuff out and her mom told her no, it takes a psychopath, somebody who doesn't have feelings, who doesn't care about the outcome, doesn't they didn't talk a lot about this, but there's a particular evaluative tool that we use in in determining psychopathy. So being a psychopath is not a diagnosis, it's more descriptive. But people who score high on this measure of psychopathy, they have things that Carly doesn't have. There's like a history of behaviors long before that that lead up to these types of acts, and so we don't really know why young people do things like this, like the school shootings and things. We don't really know the depth of it, but she's not a psychopath. I can also tell you that because she wouldn't be crying at all in court if she was psychopathic. She wouldn't even really probably be able to make herself at this age. Um, I'm not sure what grade I think she was in 10th grade, 10th grade because she had skipped a grade. So she was a young 10th grader, I think. Um, so yeah, there's that. Let's see what else. What more could the defense have, well, I mean, I am surprised that the defense didn't ask for continuance, and I really think it would have benefited the whole case more because it was very clear that both the state and the defense had experts evaluate her only 3 weeks um, before, and I wondered if the defense expert interviewed her first and then the state, or the state and then, because do you know how taxing that is too? Like, I'm sure she was glad to be talking to people, but there's definitely like one interview can affect the other if they're too close in proximity. And also, if she was administered testing, we have things called test retest effects that we look at. And it's like certain tests you aren't supposed to re give until like 6 months later, because we also have practice effects. Right. And so if I give someone an inventory to fill out about their personality and they fill it out a certain way and they think about it later and they're like, I probably shouldn't have answered like that. Then they get the test again a week later, they're probably going to answer differently. And so then we don't know. Yeah, we don't know. The defense had a different expert. The guy knew, Dr. Clark. Okay, so yeah, I thought that one, Izzy, thank you. I thought that one had happened first. And I wonder if when Dr. Webb evaluated Carly, because I thought maybe it was in July, which is still like super late to be doing that. I She should have been evaluated in March, at the end of March. So that's just so weird to me. Another really good question here. Oh, let me also say her attorney should not have been sitting in those interviews. That was dumb. And I don't know why the psychiatrists would let them do that. I would never let an attorney sit in on an interview because it absolutely affects things when another person is there, regardless of who it is. And especially if it's the attorney, for either side. And if it was an insistence thing and I had to let them, I wouldn't let them say a word, because that I'm not evaluating how she performs when people encourage her and prompt her. I'm evaluating how she is, just how she is. So that was really dumb. So I kind of think in some ways both of these evaluations were tainted because of the attorney being present, because Carly, we know people respond differently depending on who's in the room. And that's also why, among 8,000, maybe 8 million other things, when Dr. Lewis interviewed Letitia Stout, okay, I know, but still, she had her son in there video. Okay, let me just not even start talking about that. Okay, another thing I would have asked, yes, or at least not in eyesight. Another thing I would have asked her more about is her journals. I don't know if her full journals were given to Dr. Clark, which seemed like maybe they weren't. I would have sat with that discovery with Carly and gone over all of the things she talked about in there, because she was clearly more open in her journal than Dr. Clark described her being with him. And so I would have gone through and said, what are you talking about here when you say this? What were you talking about here when you said this? Because you need to understand their thought process. And that leads to some of the why, right? And then, her thing about when she said, well, one of you might be reading this someday. Who are you talking to? That kind of thing. So don't know if they did, and maybe they did ask her, but it just didn't come up. But I feel like those are really important things to go over when you have such rich evidence like that, like a video or you have a journal. Um, I also kind of wondered if anyone had shown Carly the video they had of the crime beforehand, if that was something that they reviewed with her, because I would have asked to review that with her in my evaluation and ask her what her thoughts and feelings are about it in that moment. I think in interviews, we aren't trying to get anyone to dissociate. That's not something that we're trying to do. But pressing someone at times can help you understand their reaction to things and what their thought process is about it and how they cope. And so you're in a safe setting where you're present and can help them if you need to. But I think some of this stuff needed to be reviewed with her in that evaluation. Um, Again, this was the quickest NGRI case I could ever remember, especially the fact it's an adolescent female. It's such a rare thing. I don't think this was fully evaluated the way it should have been. There should have been a continuance. There should have been so many more people spoken to about her. She should have been spoken to so much more. I just feel like I don't know. Um so let's see here. What else did I have? What other questions did I have? I have a ton of them, and some of them I kind of answered within. Um, I think I've kind of addressed most of these. You guys can let me know if I've left something out. One of my favorite questions, because I had to go back and do some research on this, but one of my favorite questions was how I thought this would have been different um, if Carly was a boy and not a girl. Because, we have the school shooters that have been boys. Aiden Fucci, who killed a classmate of his, the girl. And I had to go back and talk and look at how Aiden's case was similar or different. And it was similar in some ways, because he did have like some dark comments and things he would make to people. He did smoke marijuana. He actually told a friend that he was going to take a girl, drag her into the woods, and stab her. And I don't think people took him seriously. And so, yeah, there's that. Aiden Fucci, um, in the research I did, was he did display behaviors that were psychopathic in nature previously. He had engaged in physical violence, nothing he ended up getting in trouble for, so that wasn't documented, but he did have some fights related to drugs. He would surprise his girlfriend from behind her with two knives, which he named, I guess, and he would pretend to slit her throat, which girl, what? Oh my gosh. Hey, Michelle, thanks for being here. Yeah, so okay. But also he was described by other people as a numb child who had no feelings and didn't care about anyone, that he was glazed over in the eyes, that that's not how anyone described Carly. People described her very lovingly. And after the crime, he went on Snapchat taunting and saying, "Hey, has anybody seen my victim?" Not my victim, it was her name, but and had been Tristan, and had told his friends, "Yeah, well, whatever. I'm about to get arrested." And so there were differences in his case. However, I do think that there's some legitimacy to if this was Ashley's son and the same things were said about him, I do think that people would be less sympathetic toward him. Absolutely. So yeah, that was a very, very good question. I think, we can talk about the way they dressed her. I thought was ridiculous because, um, oh wait, Izzy, let's talk about this. So her family didn't give mitigation statements. So I don't know what the laws are in Mississippi, but when the judge read the guidelines for sentencing, when the jury did, it was up to them to so they had to go by those and those alone. And the historical things that were in there, um, they had already addressed in trial, and the attorney was already able to pinpoint in the statement prior to sentencing. So I think they were not allowed to consider um statements, victim impact statements, because that was not a part of what they had to use to determine sentencing. That's why I think they didn't call anyone. Now, the age thing, because of the age consideration, I, as a defense, if I were a defense attorney, it's like, I shouldn't even say that because whatever, I'm not, but there's decent research about the brain development and neurological development of teens, right? And how their brains aren't fully developed. And I would have called a witness to speak on that. And right, so they said they didn't want to call any witnesses for sentencing. You're right, Izzy. But if those witnesses weren't going to be able to speak to any of those mitigating factors that they have to consider, like we already knew her family history, we already knew her age, we already knew, like, a lot of those things, like, so the victim speaking, well, not the victim necessarily, but her family speaking just about how much they love her and how she's sick and not a psychopath and that kind of thing. They weren't, I don't think, allowed to consider that information. Um, they can call witnesses, so that's why I would have had a neuropsychologist go speak to the research on brain development and her potential for rehabilitation, because in determining parole or not, then, that's that's kind of, I think, where they were gonna be at that point, right? So they should have called somebody to talk about her potential for rehabilitation. Um, yes, hook me up with Defense Diaries, Bob. Yeah, that would be awesome. I would totally talk with Bob. Um, Another thing I would have done, the other thing, I don't know, we won't know if they do this, so maybe they did. But whenever there's a case like this, I feel like defense teams need to hire consultant forensic psychologists to help them um, generate questions to cross or direct question the experts that they're using. Because I always see this potential for questions, like, don't focus on these progress notes that the therapist wrote. They're meaningless. Like, there are better questions you can ask besides going through every single part of the record, right? Like, with the experts, ask them why certain things were left out. Ask, like, I just feel like consultants could be used so great. Like, in such a good way, and I'm not sure that they ever actually are. Yeah, so I don't know. Do you guys have other questions? I feel like I might have missed some, and I'm so sorry if I did. Um, I do think that Carly can be rehabilitated. I think it's really tough though, regardless, because it's gonna be so hard to trust anybody, any providers in jail. They're also pretty transient, like, people don't usually stick around for very long, and that's why I wish that she could be in a juvenile facility for a few years, because the treatment's so much more robust there. Um, an adult prison, I just feel like it's not going to, and she's gonna be in solitary until she hits 18, which is gonna be, like, that's just such an important your teenage so there are 2 times in your life where brain development is, like, massive, right? And one of those is early childhood, like, early years, and the next one is adolescence, the next one is in your teen years. And so, if there's any better time to affect change in somebody, it's in these teen years, and she's gonna be in isolation for her teen years, and I'm just so sad about that regardless. I just think, as awful as it is what she did, again, as a mom, if my child did that to me, I would still not want them to be in isolation for the rest of their life. So, um, I do. We don't have a better way to do it. It feels like there really should be a middle ground, somehow. Um, yeah, so many lost opportunities, Jules. Usually in high profile, yeah, they do. I guess we don't really know though. They don't necessarily talk about it. And oftentimes those consultants aren't necessarily in the courtroom with them at the time. It's something they do. Like someone will send me a report. I've done this for custody evaluations before. One's already been done, right? And so then I serve as the consultant to review the custody report, and then I help the attorney prepare to question or cross-examine the doctor who did the report. But I don't sit in court with them. It's just a thing I do beforehand. I think that this could have been a time where, but again, like I said, these experts doing a report in 3 weeks on a murder case of a juvenile, it blows my mind. I can't even, and the fact that one was 85 pages, I'm just so like, I don't get it. He's a robot. He guaranteed dropped everything in his practice for a couple weeks to do that. Yeah, so I don't know how swiftly an appeal would go. I really hope so. And I really, there's, yeah, I know. Yeah, Jules, she is. She's going to be stunted because that growth period, like the lack of interaction, the lack of interaction she's going to have. Like social interaction is so important for teenagers to be able to navigate life and conflict. And, I, I think it's inhumane. I'm just going to say it. I think it's inhumane to have an adolescent, a 14, 15-year-old in isolation for the next 3 years. I don't understand how that's allowed to happen in America, but it does. Any other questions? Man, I hit right on an hour. I thought we were going to be so much longer. I hope that I addressed everything everyone was wondering about. You can always message me on Twitter, or you can email us at forensiccontent@gmail.com if you have other questions. This was really, really cool. I love hanging out with you guys. I hope you'll catch our other shows. Scott and I are going to go on Monday at 7 Eastern, and we're going to review like 5 different cases that are kind of up and coming and going on, just as sort of a what's happening next. I would love to be on with Bob for the next insanity case. I'm not sure which one that was going to be, but let me tell you, we will be talking about Sarah Boone because she's like one of my favorite people. And let's see, what else will we be talking about? I'm trying to think if there are any other insanity cases coming up. I don't know. A lot of insanity cases start with competency hearings, and then people being found not competent, and then they have to go into competency restoration, and so that takes a while. And yeah, so I know I need to do some more sketches. Things have just been heavy lately, like the cases we've had have just been ones that I'm like, yeah, it's just not that funny. I mean, not that Sarah Boone's case is funny, but she is just something else. Like I have my wig around here somewhere, but anyway. All right, guys. Thanks for being here. Please like the channel, tell your friends, subscribe. Thank you for such an awesome turnout. You guys are the best. What Jules? Pause. She was on a game show. Sarah Boone was on a game show. Jules, you need to send me this clip immediately. I have to see this. I'm dying. I'm not gonna be able to sleep tonight until you send me that. Okay. Awesome. You guys are the best. I'll see you soon. Bye.